She has been breastfeeding him well. Otherwise, he's okay.
I wonder why she didn't come to the health center soon. She's obviously had this infection for several days.
Most women of here, once they deliver, they think that's the end of the clinic. You tell a mother, come back 6 days after delivery. She says yes, but never comes back.
You should always make it clear that serious problems can occur for the mother and the baby. During the first week after delivery, that's when most deaths from childbirth occur.
I always tell these people.
Don't say always tell these people. This woman delivered, and it is obvious she was not on her way here.
I think you're overreacting.
I don't think I'm overreacting. This woman has a fever. She's bleeding, and her baby's cord is septic.
That's why we always insist that mothers and their babies should come here for examination during the first 6 days. That's when most problems are detected and handled early.
You don't have to shout at me.
That is because you shouted at me. I'm an old woman, and I don't need any of that.
This is Amana's surgery room. Oh.
Mr. Wilberforce, what's the meaning of this?
Dr. Sophia, this is Mrs. Talimwa and Mr. Magola. They are from the District Health Services. They came to tell us about the Yellow Star program.
Please accept my apologies. I was not made aware of your coming today.
But Dr. Sophia, we informed weeks ago. The letter was placed on your table. Maybe someone removed it. You should take care whom you let into that place. There are important documents kept there, you know.
Thank you, Mr. Wilberforce. I'll make sure I check on it. I trust my clinical office has taken good care of you.
Oh, yes, he has. And I can see you have a patient you're busy with.
In the meantime, we could meet more of your staff. Your dispenser, for example.
Oh, yes. Mr. Innocent is a very efficient fellow. The ministry has supplied us with all the drugs we need. And with that kind of stuff like Mr. Innocent and the good doctor here, everything is well and truly managed.
That's good, Mr. Muchoke. So I believe all the stock records will be up to date then.
Oh, yes? I'm not saying we don't have occasional problems.
I'm so sorry, Sister Gertrude. I shouldn't have shouted at you. Please forgive me.
It's okay, but please don't do it again.
Good morning, Mr. Banda.
Morning.
You want to see Dr. Bagara?
Yeah.
Even Mr. Wilberforce is there with the district people. They all come to speak.
Good morning, Mr. Banda.
Morning.
I was just telling these good people about the new latrines you organized to be built.
Oh, yes, we are doing our best to help. And anything the community can do for the health center.
Yes, first, I would like to introduce our LC3 chairman, Mr. Zachary Banda. This is Mrs. Talimwa and Mr. Magola.
Hello.
Hello. Hello.
They are from the District Health Services. They came to tell us about the Yellow Star program.
Oh, yes, the Yellow Star. We are sensitized about that. You're welcome.
Thank you.
So what's the verdict?
Well, we are yet to find out.
Give her vitamin A as soon as she regains consciousness. We'll also give metronidazole 500 milligrams IV 8 hourly, Ampiclox 500 milligrams IV 6 hourly, for the next 3 days.
Yes, doctor.
By then, she should be feeling well enough to go home and complete her course of antibiotics from there. Do we know where her husband is?
He's working, but their neighbors will tell him. He'll be here, don't you worry.
I have to talk to him. Next time, she should give birth from the health center, where we can look after her properly.
And make sure she comes back with her baby for checkup, yes?
Yes. Thank you.
Good morning.
Good morning.
Good morning.
How much is a cup of tea?
Only 200 shillings. Tea with milk.
Give me a cup of tea with milk, please.
Thank you.
That's a nice baby we have there.
Thank you.
Are you here with baby for checkup?
Oh, yes. These people you see here, they know what they are doing, I tell you. As soon as my baby was born, it was immunized. Then they told me to come back, and I was here immediately after 6 days. They checked baby, checked me, weighed baby. I tell you, what didn't they do? You see my baby. Doesn't my baby look good?
Yes, it looks very good.
6 weeks later, I am here again.
That is
very good, but some mothers are funny. You know, they don't come back. Me, I can't understand why a mother shouldn't bring back her child to be checked. That's why My child looks so nice and healthy.
You're very responsible, madam.
Yes, I am very, very responsible, me. You should see how people look at me and whisper, nice baby, wonderful baby. And you know, I don't blame them. You also see the baby for yourself. Is it bad looking?
No, not at all.
Let me know who gets on your mind like a minute. Nada, you need it, you get hit like a Weezy. Touch me and tease me. Let me know, ma. Let me know. Do you feel me?
Mr. Weber, can you please turn that music down?
What?
I say turn the music down. Mr. Weber, don't you think that that music is a bit too loud and disturbing?
Is that what you came to tell me?
Well,
If it is, thank you. I've got the message.
I had actually come to say thank you for saving Mrs. Mutungo and her baby's lives. Mr. Lieutenant,
Yes, Madam Doctor.
are those the stock cards?
Yes.
Are you updating them?
Yes.
Can I take a look at them?
But you have not finished.
That shouldn't be a problem.
But you have not finished. And Mr. Bafos has to sign them first.
I don't think that is necessary when I am around.
But that is what Mr. Bafos said. Speak to him first.
Very well. I will certainly speak to Mr. Wilberforce about that.
What are you saying?
I am saying I have an appointment. And you know I have an appointment because I've been here before to have an appointment.
What do you think this is? Your home. When the midwife is ready, then you shall see her.
What is going on here?
I'm telling this nurse I have an appointment and she's just being rude to me like always.
Monday, is this true?
She's lying.
Me? Such wickedness.
Monday, I cannot allow such behavior. You must treat all our patients with care and politeness. I don't want ever hear of another incident like this one. Understand?
Man, what are you doing distracting my grass? You must have a regiment of wounded at least.
Another one they stopped me for in the road. His wife is the one who set fire to the hut. He came home, fainted.
No, I'm all right. I'm all right. It was the shock. Where's my wife and son?
You come, I'll show you.
Mrs. Kajansi, it's good you've come back. Oh, and baby looks so well. You still breastfeeding him?
Only milk. He can drink and drink and drink. But me, I only give breast milk. The nurse told me it's the best.
That is true. For the first 6 months, you should only give breast milk.
Okay.
But now, I think I should weigh him so that we'll make sure he's growing well.
Hey, he's crying.
Don't worry, Mrs. Kajansi. He knows what I'm doing. He's okay. We've done this before, haven't we?
I think he enjoys coming here to be weighed.
He's a beautiful baby. You see? He's gaining weight very nicely.
That's good. He takes after me.
Has he been immunized already today?
Not yet, sister.
Okay, I'm going to immunize him now, and you will need to bring him back 3 more times.
I know.
Mr. Banda, good morning. Morning. Mr. Mogola, Mrs. Talimwa, has Mr. Wilberforce shown you everything you wanted to see?
Oh, yes.
I'm sorry for not being able to be with you.
That is okay. We know that you're very busy. And Mr. Wilberforce, he has been of much help to us.
Well, the place is less hectic now. We can move to my office. This way, please.
Thank you.
Thank you.
Hope, Jane, please tell Moses, Gertrude, and Innocent they should come to my office. Mr. Band. Mr. Wilberforce, please see to that patient. She has been here all morning.
Very well, Doctor.
Well, Mrs. Mutungo, why didn't you come to the health center after the baby was born for checkup?
I thought everything was fine.
We could have helped you. You know, the first 6 days after delivery are so critical. That's when most problems often occur.
I'm sorry.
Here's baby Daudi. Oh, he's a little underweight. You need to breastfeed him whenever he's hungry. Until he's 6 months old, just give him breast milk, okay? Nothing else to eat or drink. Mr. Mtungo, your wife and baby were in a fire, and your wife here has an infection of her womb, which we are treating. They'll both need to stay here for the next 3 days while we treat your wife.
How is the baby?
Oh, the baby is fine. Your wife needs to breastfeed him more often, and of course remember the immunizations.
Okay, sister.
Okay, Mr. Mtungo.
Thank you very much.
Okay.
Thank you.
Our job is to assist you in identifying your priority problems and help you come up with plans to solve them. Then it will be our joint responsibility to make these plans happen. So let us look at the standards, please.
The health facility looks clean, with water, lighting, and excellent sanitation.
Your medical treatment is very good, and your staff are very competent. Your record keeping needs some improvement, however. And your dispenser was uncertain about his stock of drugs. I think you should look into that.
Thank you, Mr. Mogola. Mrs. Talemwa.
Please continue. Do not allow me to disturb you.
Thank you, Mr. Wilberforce. Please be seated. Now, I believe we should choose 2 members of staff for our quality care team that will help us here at the facility to achieve the Yellow Star standards.
That is very important.
I would like to include our midwife, Sister Gertrude. And for the second member of the team, Mr. Wilberforce, I think you will agree with me that we need a young, active member of staff, Mr. Moses Wema, our lab technician. He is a bright young man, and he has proved that he cares about the center and the patients. The first few weeks after childbirth are particularly dangerous times for the mother and the baby. That's why mothers should come with their babies for checkups 3 times after childbirth. The first checkup should be done within 6 hours, the second checkup after 6 days, and the third visit 6 weeks after childbirth. If we can raise the quality of care, more people will use our services, and then the health of the whole community will improve. Our new quality of care team will make a difference, I'm sure.
Take me to the center.